Episode 1. What is epidemiology and why it matters? Podcast title, EpiDecoded, Making Sense of Epidemiology. Estimated length, 12 to 15 minutes. Intro music, soft, upbeat instrumental fades in. Host you. Hey there, and welcome to EpiDecoded, the podcast where we break down the science behind public health, one episode at a time. I'm your host, your name, and I'm really excited to have you here for our very first episode. Whether you're a student, a healthcare worker, or just a curious human trying to make sense of how disease impacts our world, you're in the right place. Today, we're kicking things off with the big foundational question. What is epidemiology? We'll break it down in simple terms, look at what epidemiologists actually do, and explore why this field is so critical, not just for pandemics, but for everyday life. Music fades out. Segment 1. What is epidemiology? Host, alright, so what exactly is epidemiology? The most straightforward way to say it is this. Epidemiology is the study of how disease is distributed in populations and the factors that influence or determine this distribution. In other words, it's all about patterns. Who gets sick, where, why, and how can we stop it from spreading or happening in the first place? Epidemiologists don't look at individual patients like a doctor would. They look at groups of people, cities, countries, populations. They find patterns, and they look for causes. The late Dr. Leon Gordis, the legend behind the textbook this series is based on, put it beautifully. He wrote, "Epidemiology is the basic science of disease prevention," and that's really what it is. It's not just about understanding disease, it's about stopping it. Before it even begins, segment 2. What do epidemiologists actually do? Host. So what does an epidemiologist actually do all day? Picture this. You hear there's an outbreak of food poisoning in your city. Health officials rush in to figure out where it started, how it spread, and how to stop it. That's epidemiology. But it's not just outbreaks. Epidemiologists track diseases like COVID-19, measles, and heart disease. Study what causes those diseases, like smoking, pollution, or poor nutrition. Test and evaluate health interventions, think vaccines or screening programs. Influence policy, like seatbelt laws or banning trans fats. And even help design better healthcare systems by analyzing data. Think of them like detectives for public health. Just like a detective looks at clues to figure out what happened at a crime scene, an epidemiologist looks at data and patterns to figure out what's making people sick. Segment 3. Real-world stories of epidemiology. Host. Let me tell you about 3 real stories that show how powerful epidemiology can be. First, Ignace Semmelweis. Back in the 1840s, women giving birth in hospitals were dying at alarming rates from something called childbed fever. Semmelweis noticed that the doctors delivering babies were coming straight from doing autopsies. Without washing their hands, he introduced hand washing, and death rates dropped dramatically. That was before anyone even knew about germs. He used observation and logic, foretold of epidemiology. Second, Edward Jenner and smallpox. In the 1700s, Jenner observed that milkmaids who got a mild disease called cowpox didn't get smallpox, a deadly disease at the time. He tested his theory by infecting a young boy with cowpox and then exposing him to smallpox. The boy didn't get sick, and vaccination was born. It wasn't luck. It was keen observation and a hypothesis based on population patterns. And of course, there's John Snow. In 1854, cholera was killing people in London. Snow didn't buy the popular belief that disease was in the air, the miasma theory. Instead, he mapped out cases and noticed something strange. Most deaths were around one particular water pump on Broad Street. He had the pump handle removed, and the cholera outbreak stopped. That's epidemiology in action. Segment 4. Why it matters to you both. Now, you might be wondering, okay, cool story, but why should I care? Here's the thing, epidemiology shakes the world around you. The fact that you got a flu shot this year, that came from years of data, studies, and risk evaluation. When COVID-19 hit, epidemiologists modeled how it would spread, helped decide when to shut things down, and when to roll out vaccines, the labels on your food, the pollution limits in your city, the rules around how many hours a doctor can work without sleep. Yeah, epidemiology. It's the foundation of smart, evidence-based public health, and honestly, it's more important now than ever. Because as the world becomes more connected, and as we face new health challenges, the ability to understand patterns, prevent illness, and protect communities becomes a superpower. I'm Pro Host. And that's it for today's episode. What is epidemiology and why it matters? We learned that epidemiology is more than data and charts. It's detective work. It's preventive. It's the story behind every smart health decision you've ever seen. In our next episode, we're going to explore how diseases actually spread from person to person through food, water, air, and beyond. If you enjoyed today's show, take a moment to hit subscribe, leave a review, or share it with a friend who might find this fascinating. You can follow us on Insert Your Social handle for updates and bonus content. Thanks for tuning into EpiDecoded. I'm your name, and until next time, stay curious, stay informed, out from music phase in hand end.